want to do before I get started, I want you to understand how I want you to think about this and how I started to think about this more and more as I deal with this issue. We emphasize the psychological components of veterans. We talk about PTSD, we talk about traumatic brain injury. What we don't talk enough about is culture. We don't talk enough about sociology. And what I want you to, my hope for you is to take out of here is that you have a cultural clash. And my goal for you today is to teach you a little bit about the veterans' culture, teach you a little bit about what they deal outside of the university as being members of that culture. And then we're going to talk about what I did. I want you to understand my methodology. When Bud asked me to come here and talk and say, well, how do veterans do in school? I said, well, you know, Bud, it's been, I think, a week or two since I was in graduate school, and at least a week since I taught for my visiting professorship 1 year after I graduated. So I did what I'm trained to do, that thing called research. I called a veteran or two I knew and I said, tell me, what's the problems in school? And you'll hear what their concerns are. And these are concerns from all over the country. And I hope you'll enjoy that part. I also asked you to do some concerns. Now we're a relatively small group, we have time. Please feel free to interrupt me if you have questions, if something's not clear, you want to hear more, or tell me to move on. I don't care, okay? So, I also want to talk about something just as you came in about the issue of culture. I work in the criminal justice system, okay? I evaluate veterans and other defendants, primarily for criminal defense, and I form an opinion about them. And then I have to present that opinion in court. But one of the ways I do this is, for fun, I name cases. I look for theme music. So when I thought about this, I tried to think of some theme music. And you heard some when it came in. But you know what the problem I had was? I grew up where you turn on the radio and every other song was about a war. I couldn't find any music. There is no popular music about war. And we've been in war for 10 years. We have a military that has been serving for 10 tours. Vietnam, 2 was a lot. 3 was virtually unheard of, and few made it past 3. We have guys who are doing 10, but we don't have any music. Think about that for a while. Why don't we? So that's why I put on some music for you, because it's about the paranoia we have. The other thing I wanted to have you think about here is the task of the veteran. We use the word reintegrate. But I want you to think about the real task, and I'm going to try to persuade you of this, that what we have done is we've enculturated a veteran. And he's done what you've done as faculty. He's worked as hard as he can to be the best he can. And while we're not here to talk politics today, okay? I'm not getting into war and anti-war, but I want you to recognize one thing. You can't argue with the fact. We have the best military in the world. Our soldiers do the best. And then we discharge them and we say, go reintegrate. We don't educate them to, they got to go to a different culture. So they're like you. Every one of you in this room, I worked my butt off to get a PhD. I wanted to be the best. So I'd like you to think about it this point of view. Imagine a world without tenure where they come to you and they strip you of your PhD and they say, go reintegrate into the world of work. You can't be part of academia anymore. Have fun. That's what we do with soldiers. We overtrain them till they're the best they can be. They're trained to be a team. They do their job incredibly well. And then they come back and are told, hey, now you're just a 24-year-old kid. Have fun. So I'd like you to think about that as we go through this today. Aha, there we go. So I want you to think about what a veteran is. A veteran is someone at one point in their life wrote a blank check payable to the United States of America for an amount up to and including their life. That's what a veteran is. What a veteran will tell you is they don't like to brag. They just did their job. But they wrote this check to be part of something bigger than them, bigger than the country. But that's what a veteran is. That's who's coming into your classroom. So we're going to talk a little bit about culture. The military culture, like the academic culture, is a shared set of beliefs. It's about how you think and behave. It's based in the military on the mission. And this is a concept you really have to understand. In the military, there's a mission. And the mission is all that counts. You never quit till the mission is met. It starts with boot camp, where you lose your individuality, in basic training, where you learn to do the primary duty of any military person. As George Patton said, the primary mission. It's not your job to die for your country. It's your job to make the other son of a bitch die for his. That starts in boot camp. It's reinforced through discipline, professional ethics, ceremony, etiquette, group cohesion. This is a world we're not familiar with. You walk on a military base, what's the first thing everybody says to me? Hello, sir. And I go, did I get that old? They say, sir, to everyone. Ceremony. All you need to know is right here. But you got to learn, you got to know how to read it. I don't. That's why I have Bud Brown in my life, because I make him translate. Okay? Group cohesion. This is the most important thing. War, with all due respect to the veterans, is a team sport. If everyone does their job, in spite of the risks to themselves, you win the battle. If one person doesn't, you all end up dead. You have subcultures like in any culture. Branch, Air Force, Marines, within, SEAL versus Ranger. But one thing you always have is you're always in the military. Your color or skin doesn't matter. As the Marines say, you're either light green or you're dark green. You're not black, white, you're not male, female. You're a Marine. That's part of the ethos of the corporation. So in understanding, you got to know where these people are coming from and how they relate. Okay. So you have the Army. This is their mottos. This will defend. The Navy, always courageous. The Marine Corps, Semper Fi. Air Force, above all. The Coast Guard, always ready. So this is drummed in from the time you enter into the service that you have your motto and you will live up to it. And that's all that counts. The basic tenets of the military are duty, honor, country. The emphasis is on discipline and hierarchy. That's not the world of academia, obviously. Maybe. But it's the group over the individual. The irony of the military is they give up their individual identity to fight for our individual freedoms. Like any culture, to work, it has to have cultures and rituals, and it does. And military law is different than civilian law because it compromises some basic rights civilians take for granted for one thing: unit cohesion, the ability of the force to keep fighting. But it demands virtue, honor, patriotism, and subordination. Having done some military court-martials, I can tell you it's just amazing. Everyone tells the truth, no matter how painful or self-incriminating it might be. You wouldn't believe the world of military discipline because it's based on honor, duty, and honesty. This is my chance to embarrass Bud Brown. I don't know why I'm giving this talk. You have the world's leader in military culture. This is Bud Brown stuff. The total military institution. Total institutions, prisons, military. Everything you do is controlled. But here's your things. You must obey without hesitation. There is no thought process in this, folks. You are overtrained. So no matter how scared to death you are, you can do it with what's termed muscle memory. Obedience. Obedience to saving the group. Discipline. This is the one that makes civilians kind of uncomfortable, to kill without hesitation. But they're not killers. They're trained to kill. There's a huge difference. They're trained to kill within the rules of engagement, that thing called discipline. Survival, whatever it takes. Whatever it takes. Sacrifice. You give up your individuality the moment they cut your hair and you go to boot camp. But the ultimate, to give up your life for your buddy, for your country, for honor, without thinking, without ever thinking. Now this one I want you to spend some time looking at it, because I want you to look at what are the differences when our soldier, who went in as a civilian, had all that stripped away to have everything in the military life. And then, when he come back, we say, forget all that military stuff, go back to the civilian side. Oh, by the way, we spent a lot of energy and money and time stripping away every one of those beliefs to replace it with us. So, contrast, uniformity versus individuality. Anonymous, I'm a member of my unit, platoon, versus choices. What would you like to study? What would you like to write your dissertation on? Depersonalization, it's not about you. Nothing is about you. Versus our main goal, relax, vacation, the one thing that's all ending for you all. You have to go back to work on Monday. Expendability. This is a big one. Because remember what the military teaches. Ultimately, you are expendable. We know. We're going to send you into battle, and half of you aren't coming back. We don't have any illusions. Commanding officers have no illusions when they go into battle that everybody's coming home. Soldiers know some of them aren't coming home. This is an issue because I think that's what they feel like when they get here. Their excellence is not recognized. They're supposed to go back to that civilian world that's been purposely stripped from them. Hard work and boredom. Boredom punctuated with a mortar attack, but, it's still boring. Teamwork, camaraderie, stoicism. You survive with what you got. Use it, recycle it, and if you don't have it, live without it. Versus luxury and waste. That's broken by a new one. Oh, your BMW is only a few years old? Why not? Buy a new one. the civilian ability to be emotional as opposed to stoic and obeying. Loneliness versus togetherness. Don't confuse camaraderie with not being lonely. It's lonely in a group. Can't get too close, and yet you rely on these people for your life. Trust. Trust. This person sitting next to me, no matter how much I like, is in my foxhole, and I will save his life or her life, and she or he will save mine. Versus uniqueness. Particularly think about that in a university setting. That's what we're all about, is unique. Our unique subspecialty, our dissertation, our knowledge in a given area. Orderliness, that's part of being in the military world. So I want you to think about those and some of how those play out in our world. So let's talk about who are today's veterans. The average soldier. Now I want you to think about this in terms of your average college student. 22 years old, married with 2 children. That's not my understanding of the college campus, where you're not married, you don't have children, you're not even thinking about it until you're 27. You're a high school graduate, you're a corporal, you've been in the service for 4 years, you're making about $2,000 a month. It's 60-40 split. It's mostly male, and it's mostly a male culture. And your average workday, back to the most important thing, when the mission is complete. That's sometimes why veterans get in trouble in school, because they have to finish the mission. They can't say, not a good idea for me to be this term or in this class. Once they commit, the mission must be complete. Just basically some issues about, here we have the National Guard, you're a part-time employee of the state, of the government, you work about 40 days, 39, 40 days a year, you do monthly drills, 2 weeks free up. But you can be called out today. You can leave this campus right now, go, and hopefully your job is here when you get back. Very hard for them because they don't get the benefits of real everyday military, of going to a base where they can meet with their fellow soldiers. Personally, that's one of the problems with Oregon. We don't have any permanent military base. If you go to San Diego, you can go to a Navy bar, you can go to a Marine bar, and you can be out of the service and meet your fellow Here, there's no such thing because we don't have a permanent base. We just have the National Guard. The veteran population in the United States, 22 million. Under 39, 3 million. In Oregon, we have 339,000 vets, and the group that we're interested in, of course, is the ones you're going to serve mostly, 37,000 of them. Okay. Now, just to add from a criminal justice system, we know that somewhere between 10 and a quarter of them will end up in the criminal justice system for at least a drunk drive, at least slapping their wife. Oh, by the way, she's more likely to be more violent to him than he is to her, just to get rid of your stereotype. And that doesn't come from me, that comes from the Veterans Administration, that the women who are married to soldiers are more violent in the home than the soldier. Coming home. Here's your transition. From cohesion to withdrawal from others. Who do you fit in with? From accountability and control to nobody's giving you orders. From targeted aggression, complete the mission and the rules of engagement, to inappropriate. From tactical awareness, hypervigilance is adaptive. If you're in Afghanistan right now and you don't notice that that rock on the wall just moved 2 inches overnight, you're going to get a really unpleasant surprise when that IED goes off. However, here, it's hypervigilance. Here, that means just sitting in a classroom could be a problem if you can't get against the wall, if you can't be in a place to protect yourself, or just because all those people are around. And just like in a war zone, you don't know who the good guys are. You're lethally armed in the service, but it's in a very controlled way. At home, you're locked and loaded. I always try to point out to people that pay attention to gun ownership because that tells you a little bit about how things are going. And civilians can have opinions about gun ownership as a bad thing, when for a veteran, my favorite term of a recent guy is, nobody understands why I own guns. Civilians own teddy bears. I own guns. They make me feel better. And I just own them because they make me feel better. Emotional control in the civilian world becomes detached and uncaring. Combat driving. One of the signature issues in these wars is combat driving. Regardless of what your MOS, that's military occupational specialty. You should learn a few words like that. It's what you did. And oh, by the way, they're going to give you a number, and you're going to go, no, really, what did you do? Don't tell me the number. I'm stupid. I don't know. Ask. Here it becomes aggressive driving because they're on automatic pilot. You know, it only takes a few hand grenades off an overpass to have you learn to switch lanes without thinking on a freeway. And I actually had a vet that I evaluated, and that was what he did. And I made him a bet. I said, for every day that you drive through Portland and there is not a hand grenade thrown at an overpass at you, give me $1. And every time there's a hand grenade thrown at you, I will give you $5,000. And he says, why would I do that? You're going to get rich. But he can't control it. Discipline and obeying orders, that's what it's about. Here, civilian world, there's no chain of command. They don't know who to listen to. They might ask you inappropriately to give them orders, to define the mission, to complete the mission, and you're going to go, what? That's not my job. You're supposed to figure it out on your own. What's the difference? 1 in 4 Americans have a connection to the military. 1.5 million people have served in this war. Nearly half experienced multiple deployments. Half have psychological symptoms in the National Guard. We have a very high percentage coming home with PTSD and TBI. We know, the military has known since time immemorial, that combat exposure is like a drug. The more exposure you have, the higher likelihood of your PTSD. They have dose response, yet we have 10 deployments. Now I'm going to say my cultural one. The biggest change for me is during the non-war, everyone knew somebody in the war. Everyone. I was lucky enough to win the genetic lottery and went to an elite Catholic school. Yet 1/4 of my graduating class died in Vietnam. 1/4. I can't tell you how many funerals I went to, how many long-lost friends of my parents I met to go bury their son who had gone to war that I had never met. Now I have kids in college. They don't know anybody who's a veteran. How can that be? How can it be we have no music? This is the most important one. You don't come back unchanged. Don't get fooled. Just because they weren't in combat doesn't mean they didn't come back changed. One of the most damaged guys I ever saw was a helicopter mechanic. And he couldn't live with himself because he was always inside the wire. Always. Yeah, there was a mortar attack or two. He says, but Nothing ever got close. I was never scared. But then one day, the pilot of the helicopter he serviced on a regular basis came back. Came back not pretty. And he can't live with that. Because worst of all, that pilot was a woman. And what was he doing as a guy in the military, behind the wire, when this woman is out there dying for her country, dying for her comrades in arms? So, get ugly out there. You can't come back as the original person. So I am often now saying, this reintegration word, we need to think about that. Maybe we need to be thinking about retraining as a civilian. Maybe we need to be thinking about more actively is, what are the skills you learned in the military that transfer? Because there are some. There are some. I'll give you one that we tend to forget about. There's a recent study that veterans who run companies run it in a more ethical manner and do not break the regulatory rules compared to non-veterans. Discipline and order. It transfers. Okay? But the more you're out there, the more you change. And remember, we have an unprecedented group of soldiers. World War II was 4 years. We're talking about guys that have been at war for 10. Keep going back. They're always deployed or getting ready to deploy. The obvious ones, life threat, loss, wear and tear on your body and lack of control. And I saved the must one for last, moral injury. This is the new one that people are starting to look at. It's always kind of surprised me because, see, I always saw that as part of the survivor's guilt issue. How come I lived? How come I died? But this is really important because one of the critiques of PTSD is rather than dealing with the cost of war, we medicalize it. Hey, you can't live with yourself because a couple of kids died at your hand? You had to pick up some body parts? That's because you have a medical problem. No, it's a moral injury because what you do in war, if you do as a civilian, gets you the death penalty. In the military, you get a medal. You get R&R. So that's part of what you're struggling with is, what is the cost of war? Even if it's necessary. And again, I'm going to avoid purposely the issue here of it, what wars are necessary and good wars and all of that, except for one thing. I wanted to take this opportunity to disabuse you of one issue. World War II veterans, in spite of being the greatest veteran generation, as Tom Brokaw calls them, are as screwed up with PTSD and TBI as this generation. We don't like to talk about it because we think they were different. And that's one of the problems veterans struggle with. There's an undercurrent of they're not real soldiers. They're not real. Korean War, we forgot all about that. That's forgotten war. Vietnam, well, that's baby killing. Well, then there's things like Grenada and all those things. So that's one of the things your veterans struggle with, is they're compared to this mythical greatest generation. So here's your comparisons, though. Vietnam, 58,000 dead, 303,000 wounded. Afghanistan, 2,200 dead, it's almost 2,300, 17,500 wounded. Iraq, 4,500, 32,000 wounded. So I'm also going to take this opportunity to deal with the elephant in the room in these casualties. Guess who's not counted in here? 22 people a day. 22 people a day. In the time that I give this talk, there will be 2 dead veterans. 2. They will have killed themselves. Many people think the death toll in Nam is double that. And to say, go back to the issue of change, the suicide rates are high among older veterans as well. We're seeing an increase as they are retiring, as they're losing the ability and the busy lifestyle they had to cope with the moral injury. It's not all just PTSD. They're having trouble living with themselves. As they come to that stage of life that we all inevitably to look back at, what did I do? What did I do with my life? Oh, that's right. I was in a free fire zone and I shot into a hooch, and then after I pulled the trigger, the children ran out and they didn't get away. What did I do? So I want you to remember in these figures, we're vastly underestimating the cost of war. Vastly underestimating it. And here's why you have trouble. 94% saw bodies or remains. 92% were attacked or ambushed. 85% know someone who was injured or killed. 55% caused the death of an enemy. Over 50% have handled corpses or human remains. And remember, that number's low because I asked the guy recently, did you see any, did you touch any human bodies? Because that's kind of predictive of PTSD and problems. And he says, no. He says, well, what did you do? And he says, I opened up the Humvee and their body parts all over, but I didn't touch them. That was somebody else's job. Saw a body wounded, virtually a quarter. Caused the death of a non-combatant. 1 out of 5. On the other hand, saved a soldier or a civilian. 1 out of 5. Hand-to-hand combat. By the way, hand-to-hand combat is a failure of the mission, okay? Remember, the mission is to never get a scratch on you. That's the ideal mission. So something's gone really bad when you're doing hand-to-hand. 12% wounded or injured. This is their experience. This is the cost. This is the experience of being the best person at your job in the world. This is your job. And let me give you a hint. Never use the word hero. You want to alienate a vet, call them a hero, because they're not heroes. They did what they were trained to do. It was their job. I can tell you about my smackdown. I was, in 1971, a 22-year-old punk graduate student, and I saw a guy from World War II who, oh my God, the pillbox, one guy, lots of dead Germans, and I said, wow, you're a hero. And he looked at me and said, son, you're an idiot. I was just doing my job. So I just encourage you to learn from my mistake. Not hero, did their job. Dirty job. Higher risk by type of training. Obviously, if you're a Navy SEAL, you're a little higher risk than if you're the payroll clerk in Washington, D.C. in the Pentagon. Okay? Although not necessarily, because a few of them happen to be in a combat zone, and I've met some of those. A true story, in a veteran here in Oregon that Bud and I worked with, he was at 9/11. And so he was at the Pentagon. And the prosecution looked at me with a straight face and said, what do you mean he was in a combat zone? He was at the Pentagon. And I'm going, let me see. Here's a man who's at the nerve center of the American military that has just been attacked by a missile with casualties, and you're asking me if he was in a combat zone. And I looked at him and I said, are you kidding? So, your levels, your training focus Tactical versus technical. Technical is support. Tactical is, are you doing it? Remember, most soldiers, most people in the military are not the tip of the spear. About 10 to 1. There's a lot of payroll clerks, there's a lot of attorneys, there's a lot of everything to make this culture run. Your potential experiences, deployments, where, how, what did you do? Is it consistent with what you're trained to do? I have a surgical nurse who ended up commanding and being the lead driver on a convoy. Not exactly his skill. Actual experience, number of combat. And then, of course, I had to steal from Bud. How much Kool-Aid did you drink? How much of gung-ho, it's all about the military, how much of that did you drink? If we ignore things, we ignore divorce rates, alcohol abuse. Alcohol abuse is highly sanctioned in the military. It's what you do. You drink. And by the way, it's a great drug. It is the best drug ever made for anxiety and PTSD. You will never have a nightmare because it destroys your REM sleep. It's the best anxiety drug on the planet except for one small problem. It's got a few side effects. But, we can't have everything. But it is culturally sanctioned. Spousal abuse, after the first deployments at Fort Hood, domestic violence rate went up 23% on the base. And I can tell you for a fact it was a hell of a lot higher than that, because one thing a military wife doesn't do is tell on their military husband. When they call, that's because they're half dead. They don't call because he pushed her. Child abuse, suicide, vehicle accidents and death. Alcohol, in my opinion, is a gateway drug. Not because of other drugs, but it gets you into the criminal justice system. In fact, my Korean War vet, who was on death row, that's how he ended up there. He had big league PTSD. He ends up sleeping under a bridge. A prostitute gets very dead. He says it's the pimp says it's him, he gets death row. So it puts you in places you don't want to be, and obviously drunk driving. That's one good way to go out. Very common, see lots of DUIs, lots of suicide by cops, lots of suicide by car. And by the way, that's planned. A lot of veterans know if you kill yourself, like with a gun to your head, oh, that insurance benefits, that goes away. But if you point a gun at a cop and he shoots you, you're a criminal. Your kids get to live. They get to get VA benefits and the insurance benefits. Now, I only have a few of these. And I put this in here because it affects what you guys do. We'll talk later about how veterans leave. But I want you to understand the other stresses they have from their support system called the VA, okay? Because one of the things you have to understand that I don't have here is if you are a vet in this area and you apply for disability today, if you're lucky, you'll get it in 315 days. 315 days. So, in 2008, we dealt with suicide. Department of Veterans, keep it quiet email. Shh. Our suicide prevention coordinators are identifying about 1,000 suicide attempts per month. 1,000 per month. Among the veterans we see in our medical facilities. These are the guys going to treatment, not the ones not going. Is this something we should carefully address ourselves in some sort of release before someone stumbles on it? Okay, next one. Oh, okay. Respond. Not for the CBS News interview request. I think this is something we should discuss among ourselves before issuing a release. Is the fact we're stopping them good news, or is the sheer number bad news? Okay, does somebody have a problem with literal concrete thinking? It might be something we drop into a general release about our suicide prevention efforts, which, as you know better than I, prominently include training employees to recognize the warning signs of suicide. So this is the organization that's helping them. Okay, I'm going to read some of these. I want to say one other thing. I didn't put in a slide, but there's also a slide that says, stop diagnosing with PTSD. It's expensive. Can't you call them a personality disorder or an adjustment disorder instead? And if you paid any attention, up at Joint Lewis McCord, there was a big scandal because the psychiatrists decided en masse PTSD disability benefits were too expensive, so they stopped diagnosing it. Okay. I just want to read a few of these, okay? I don't know if you saw some of these when we were in, but these were before, weren't they?
These weren't up.
These weren't up. Okay, this is people talking about Karen, Spec 4, U.S. Army, military police, Iraq. I wanted to go to school. That's why I joined the Army. I wanted to have a family someday. Now I don't even want to have kids. I do not want to be responsible for my kids doing what I did over there. Her father's a police officer. Now, remember I just talked about moral injury. There's a pretty good description of moral injury. Don't do what I did. I wanted to be an MP because I wanted to be like my dad. Now I can't even talk to him because he asked me stupid questions. Richard, gunnery sergeant in Iraq. I got out of the Marines about 10 months ago. I was in for 20 years and 1 month. I'm 43. My wife took off with my 2 kids and she has a restraining order against me. After 20 years in the Corps and 3 tours in Iraq, they say I can't even see my kids. I can't find a job. I've been looking, but with the problems I've had with my wife, nobody seems to want to hire me. I was charged with violating the restraining order in San Diego just before I got out. My commanding officer went to court and the charges were dropped. I sometimes wish I had been killed in Iraq, but then the bitch would get all the money. See? Change, experience, fight for freedom and lose it. My family keeps asking me questions about Iraq, and I don't want to talk to them about it. I don't want to think about these things now. I'm getting tired of avoiding their questions. I think I'm ready to break from all of them, meaning as family. Happy homecoming. Okay. So what I wanted to do to this point was just give you an idea of the military culture, the changes, and a very potent force that you're dealing with even though you don't deal with it, called the Veterans Administration, okay? Now, I want to take this opportunity to have you think about this. I'm going to describe you a group. This is a group that consists of about 1% of the population who's highly motivated, who want to be the best they can be, who work over years with great self-sacrifice and discipline to accomplish that goal. Who am I talking about? Every one of you in this room. Not easy getting a doctorate. By the way, it also happens to be true of your veteran students. They're the other 1%. And they went in the military just like you to become the best they could be. They pursued their individual interests and skills to be the best in the world at what they did, just like you. So you have some commonalities here. And I want you to think about this because I don't think we pay enough attention to cultural competency. We think we're doing civilian military. No, you're dealing with a cultural issue. Your students are part and were trained in an entirely different culture. Now, in interacting with them, Here's some things not to say. Now, by the way, I want to go back to my methodology, okay? Some of this is my experience, but a lot of this is I ask students and to go out on the internet and give me feedback. But I can tell you, athletes, never ask a veteran if they killed somebody. That's your problem. That says more about you. Because maybe they did, maybe they didn't. But they didn't do it because they were a killer. They did it because it was their job. I took some of these off of a website about funny things. These are some things vets find funny. I could never join the military. I hate it when people tell me what to do. I totally get what you went through because I play Call of Duty and that shit is hardcore. Now, by the way, you may think this is confined to people, but I had a really scary experience testifying. Because I was on the stand, and Dr. Brown was in the audience. And I was talking about this stuff to a federal judge. And the federal judge says, "Doctor, stop. Stop. I know what war is. I saw Black Hawk Down." And I looked up and I thought, where's Bud? I'm going to have to tackle him before he comes up here and gets himself into trouble. Maybe I can get to him before he gets to the bar. But he showed his discipline and didn't blink an eye. So this is not just stupid people. These are people in power who say things like this. You know you're brainwashed, right? Well, the rest of that one from things that drive vets is, yeah, right, I'm brainwashed. What sane person would join something to do something bigger than themselves? You have to be brainwashed. That's how the vet thinks about it. How dare you call me brainwashed? Isn't it like the movies? I already talked about that. And this is something you really should pay attention to because it's a joke. How are you a veteran? You're not even old. Joke. And if you can't read the bottom, 19 years old, individual experiences may vary. Now, I put this up here because this is really one of the things that vets feel. Okay? They're Joe. And you're treating them like they're a joke. You're putting them in the same category. Just back, they're a little bit older. They're 23 instead of 19. They're proud of what they did, but they're not going to brag. But they did something to make a difference. And of course, this is the one. You're stressed about exams? That's cute. So that's what they were doing while their classmates were worried about exams. Okay. These are the concerns. And, I'm going to go back to the original one. I'm back to talk to people. I'm not making this up. I asked. When I was doing this, to remind my days in graduate school, when I was being trained in tests and all the sneaky ways the psychologists were supposed to figure things out, and a study came out. It said, if you really want to know what people are thinking about and what they want to do, you can give them a test and you'll make it close. But if you ask them, you'll find out more accurate information. So talk. So here's the veterans' concern. They want respect. They want respect. They don't want to be ignored. They don't want their life experiences ignored. And if I could change one thing among veterans, it would be that when you get trained in the military, you get a certificate that makes you good in the civilian world. And I'm going to tell you another true story. Combat medic. Combat medic in combat. He comes back to Lane County and they tell him, no, you can't join the fire department. And you want to be an EMT? You got to start an EMT 101 with the 18-year-olds who are trying to figure out which end of the needle you stick in the body. So again, go back to what I try to have you imagine. Imagine being a PhD and then being told you don't have one anymore. And you could go start in your discipline in intro. How would you feel? Scared that they're going to be seen as dangerous or crazy. Now, how many of you had this thought, and don't raise your hand because I like anonymity, but think about it. How many of you thought about this, and the Navy Yard happened, and a veteran, he did something not nice. How many of you went and said, holy crap? How many am I going to have in my class this term? Oh my God. Well, let me help you out. I did some research. It's probably not complete because, the internet only gets you so far. But I could not find one reference to a veteran on campus hurting a civilian or another veteran. When I Googled how many vets had committed an act of violence or killed on campus, you know what I got back? I got a vet who got kicked off campus because he wrote about what it was like to kill, what it was like to be in combat, to fight for his life and his buddies. And it was so graphic, they kicked him off campus. Now, here's what I want to tell you. I know where I want in my room, because somebody comes in this room, I know what's going to happen. This young man here, he's going to take the bullet for me because he's a Marine. He's not going to hurt me. Why do you think I have him sitting here? He's guarding me from you guys. They talk about lack of awareness. They want you to be aware there is emotional thing. But you don't have to be afraid because they yell and scream. Okay? They're not going to hurt you. They're going to yell and scream. They're going to leave. Let them. Now, you also should encourage them and let them record. You should encourage them to let them record your lectures because they do check out. They do have intrusive thoughts. They do get emotionally involved. They should be able to listen to that lecture later because they want to complete the mission. But there are things in the way. Now, this is a big one. Political correctness insists on one point of view or ignore veteran differences. As one veteran put it, I served in Afghanistan. We're talking about Afghanistan. You didn't ask me about Afghanistan. I kind of might know something about that. Possible. Or political. Check your political beliefs at the door. This is not about whether war is good or bad. This is the guy who is the instrument, who's apolitical. Because one of the brilliance of our system is the military is apolitical. And if you think it doesn't make a difference, take a look at current events in Egypt. That shit doesn't happen here because soldiers are trained to do their job. The politics are for other people. They feel like they're set up to react. They're set up to react with anger and frustration. Often that's because of political comments. It's comments about sexual rape, cost of war. And they take that personal because they didn't do it. It may happen, but when you talk about it, they tend to take that personal. Just like you would if somebody said, you don't know anything about what you're teaching. They don't like that they're viewed as being disrespectful when there's concentration or emotional or physical distractions. They really are trying to learn. But it's often, they're afraid, will be seen as a matter of disrespect. They want you to be aware that it's scary to be around people. Most of them have had the experience of being where they don't know who the enemy is and they're around them. They don't know when they drive through a village and every day they see that guy with a phone. Is he a friendly or is he calling in an IED? They don't do well around people, so it's a struggle for them. Give them permission. Don't assign their seating. They need to sit in the back of the room next to the door. Let them. They need to leave. Let them. They want you to be aware that sometimes they don't show up or they leave because they waited 310 days for their appointment at the VA. You know, it's kind of hard to change that. Or they know they shouldn't be there. Now, I should say the word respect because that's what vets want most. You kind of look at these slides, it says it a lot. That's not because I didn't notice, but it's to remind you. Respect. That's what they want. They don't like when they feel that they're a condescending or arrogant attitude towards warriors, because these are warriors. Every one of them was trained as a warrior, even if they were the payroll clerk. They're proud of being a warrior. They're proud of being the best warrior they can be. And when they hear political slams, they can't help but take it personally. So you can help that. You can say, whoa, 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 we're going to talk about sensitive stuff. This is an attitude you're dealing with whether you like it or not. We don't hold against them that they sat behind academia while we answered a call to protect them. The expectations that our experience shouldn't be held against us is equally warranted. Notice they don't get in your face and say, well, why did you take your student to ferment? How come you weren't next to me? It's respect your decisions. That's what they want in return. We made a decision to do something bigger than us. Maybe you don't like how we were used. Maybe you're right, but don't hold it against me. I don't hold your choices against you. This is difficult because I can tell you there's some emails I got about this that I wouldn't print, okay? This is a very emotional one. This was the most eloquent one to deal with the elephant in the room. Okay? Now, they also have some positive things to tell you. Oh, by the way, they want respect. Did I say that? Did I mention that yet? Okay. They want the professor to be in control because remember, they're used to living in a world of control. So they want you to shut them up or shut up the guy who's monopolizing, okay, or is off track and say things like, sir, with all due respect, the point is, we were discussing X and now you're talking zebras. I'm confused. Maybe you have something useful. They want you to show something they need. Discipline. Keep control of the circumstances. That's what they rely on their superiors to do. And that's what they see you as. You're higher rank. They want a strong syllabus that informs and forces difficult and alienating topic. They want to see it coming, in other words. Right? They want to know on week 3, you're going to talk about why we should never have gone to war and how all soldiers commit war crimes. They want to know that. They want to see it coming. So they want a sense of control that comes from information. They want to complete the mission, so they want office hours. But they also want you to take control of those office hours. In other words, they wanted to say, I think you got it. You can leave now. We don't have to beat this for another 45 minutes. I got another student waiting. Okay? Oh, they want respect. Now, these are some more touchy topics. They're afraid of being feared. They don't want to be seen as a monster, a killer. They're not. There's a big difference. I see killers. These are people who are trained to kill. Killers do it for my wallet. They do it because they're jealous their wife went out with somebody else. They do it because they can't control their emotion. These are people who are trained to kill when necessary. They want you to know that difference. They don't want you to be afraid of them. They're afraid if they identify themselves, they'll be monitored by the campus police. That there'll be people keeping an eye on them because after all, they're dangerous, crazy vets. How do we know that? A crazy vet shot a lot of people in the Navy Yard. They want you to recognize. We want dignity and respect, but feel embarrassed or frustrated when we speak up passionately and our words fall short. They're learning a new skill. Remember what I showed you in the military culture? Unquestioned obedience. They're learning how to speak up and say, excuse me, that doesn't make sense, Mr. Professor, Doctor, I don't understand. Or I have a different point of view. Or I just don't know how to talk. Because missions are literal. Okay, I'm going to give you the best one. This is the one I often use to explain military thinking and literal thinking. Comes from Vietnam. And the commanding officer proudly announced to the news media, we saved the village. In order to save the village, it became necessary to destroy the village. And every civilian in the world went, what? And every soldier on the planet said, of course. Because what they said is, you told me to get the Viet Cong out of the village. You see any Viet Cong in this village? You didn't tell me to leave the hooches standing. You told me to get rid of the Viet Cong. You see any of them here? I accomplished my mission. What are you talking about? That's why the words fail them. They want to. And they are passionate people. They put their life on the line for something they believe in. They're passionate. They don't always say it nice. Fear. Fear drives them. Lack of respect and fear. Fear, they get in our faces about our grades or when we're confused. So I don't understand. Their fear. Having a hard time reading the group as to when they feel in danger from a student. This is from the professors. Okay? So I want to thank all of you. First, let's stop here for a minute. We're kind of moving right along. Anything more you want to hear about students before I get to what you guys told me was your concerns? This is what I got. And I think, remember I used the word respect a lot? The theme I got from the feedback I got from faculty here was fear. Fear. If I give them a bad grade, am I in danger? When I don't see things clearly, I'm scared. Will they use their military skills and put me in danger? Hey, I understand, I'm a wimp, I lose. What do we do about poor attendance? What do we do about early class exit? Tough ones. Sometimes they leave because they need to. They recognize they're not learning anything. They're not there. They're going to say something passionate. They're going to say something stupid. Or they're so preoccupied that they just need to get the heck out of there. They didn't plan it. They didn't see it coming. Maybe they have a VA appointment too. Maybe they got a sick kid, because these are kids who tend to be married more than the average college student. They leave. So what's my cure for you? Talk to them. Hey, what's going on? Can I help you? You're here. I assume you want to get a degree. You've shown your ability to become the best of the best. But something's not working. What's going on? Help me. I don't read minds. You'll start to hear some themes, I suspect. But maybe you'll stop worrying because you find out, oh, you had a VA appointment. Oh, you have a sick kid. You were in so much pain you were about to scream from your orthopedic injuries and your back injuries. I got a long one about PTSD. And the concern was that this individual had experience with Vietnam-era vet who had flashbacks and was aware that triggers can come. Scares him. Scared that somebody with PTSD is sitting in the class and doesn't have 30 years of experience to know how to manage a flashback in a classroom. Fear again. Well, here's the good news. They pretty much take care of themselves. And I'll go back again to what I can't find. I can't find a veteran attacking a professor. I'm not saying it'll never happen, because that would be foolish. But I'm saying it's not something you really have to worry about. But that might be why they leave. They're starting to have a flashback, and they kind of say, hey, this isn't much fun. I don't think I want to keep reading about war. Maybe I shouldn't have taken this history class. Maybe that wasn't such a good idea. There's concern that they're isolated from other students. Hell yeah. Hell yeah. They're Joe. A lot of the other students are jokes. And then they're dealing with a really crazy-making idea. I want you to think back to that slide I showed you. Handling body parts, killing people, killing non-combatants, saving people. And they did all of that. They did it to save their buddies. And then they come back. And they fought that. And they came back. And they can't figure something out. Why the hell do you care who won American Idol? How's that important? And I fought for that? Huh? So of course they isolate. They're not a member of the civilian culture yet. We stripped it out of them in basic training. Boy, did we. My profession has a lot to be proud of. We took the firing rates in World War II, where only about half the soldiers shot, and we made every soldier in Vietnam shoot his gun at a person. So we taught him well on what it was meant to be a soldier and got over the natural reluctance to kill. That's serious business. So it's hard for them to relate to people. You might remember the slide that I had up there. Can you go back to that first one about the woman, the Barbie? Did you all get the chance to see the slides that were floating up before we started? Okay. We'll replay those, but I want you to read them if you get a chance while we're talking. But remember what she said? She said, I'm 24, I'm sitting in the classroom. And I know I'm older, but I'm different. I look around and I see the other girls as Barbie and the guys as Ken, and I think I'm back in preschool. Because they did serious business. So it's hard for them to interact with people who are worrying about American Idol, the football game, all of the things that they'll tell you they're confused about. Because they'd like to like them. They just don't get why we do. One of the other questions is, should they be treated as disabled? Wow. No. Injured, but not disabled. Struggling, but not disabled. symptomatic, but not disabled. And I'm going to say that to you because when I first came to Oregon, I came to work at the Rehabilitation Institute of Oregon as a rehab psychologist. I had been trained as a neuropsychologist. I knew a whole lot about brain injury, but I had a new duty. I had to work with spinal cord patients. One of my first spinal cord patients was born on the same day I was. Wow. Here I am, 28 years old, talking to a guy who's born on the same day as me, who's paralyzed from the neck down. We talked about disability. And I learned something. The most disabling thing about disability is your belief about disability. The most disabling thing about disability is your belief about disability. So, I then went on to the trauma team, and we'd see new spinal cord patients. Trauma surgeons would see high levels who couldn't bleed. So I wouldn't want to live like that. I'd say, well, that's because you don't know anything about disability. You're treating them as disabled. Because I have a very interesting statistic for you. And I don't recommend you become a spinal cord patient, by the way, to achieve this goal. But if you compare spinal cord patients 16 years out compared to their age peers, they report higher levels of satisfaction and are more likely to be happily married than non-spinal cord patients. So beware of your beliefs about disability. Okay? The military, by the way, takes this seriously. If you followed it, there was a serious proposal to rename post-traumatic stress disorder to post-traumatic stress injury. That's what the military advocated because they understand in the military culture it's okay to be injured. You get a Purple Heart. It's not okay to be disordered. Okay? And so their hope was that soldiers would come forward and seek treatment if they got rid of the word disorder, if they got rid of the concept of disability, if they talked about injury. So, no, there's exceptions. You may well see some veterans because one of the things that we have done is many soldiers who would have died in Vietnam, who have certainly died in World War II, are alive because of our ability to save them in the field, because of medical advances. So you might see people who have disabilities. They might have back injuries. They might have all kinds of problems, shrapnel in their body. They may really have some things that require some level of adaptation. That's why you need to talk to them. You need to find out what they need like any other student. I have to come up closer to you because I'm old and deaf.
You had mentioned the person who saw the other students as Barbies and Ken dolls. And so that's their perspective, and it's real, right? They have very different values and different experiences. But they're in a classroom together, and they're doing projects together. And so what's a way to approach the veteran student?
Okay.
And understanding that they are, yes.
Okay. So let me paraphrase for the camera and so that everybody can hear. The question was, I talked about the veteran who talked about the other students were Barbies and Kens, and she felt she was in preschool, but she lives there. She's in that classroom with kids who are going to say, hey, I'm not Barbie doll, I'm a young adult. And what do we do with that? The answer is recognize what I said. You got a cultural issue. What would you do if that one student said, I am from, I don't know, Herman Cain land, when he said, you biscuit can, and I don't understand what you're doing. You say, well, we have a cultural problem here, don't we? And that's the issue here. The problem I think we get into trouble is we're forgetting this is a cultural clash, not a clash of values. This is learning to talk to each other. And I don't know, did my slide come up on? We haven't gotten that far. I'm going to make it come. But that's my answer, is you got to treat it. It's like, wait a minute, look, this is a person who's struggling to learn to be a civilian. okay? Because we do have to move them. Now remember, I'm emphasizing what your problems are. When I talk to vets, they say the opposite. They say, get over yourself. You know what, we're civilians, we are not the devil incarnate. And oh, by the way, yes, I can treat you because I'm not a vet. Because you know what I learned about therapy? Well, you can't treat me, doctor. I'm a woman. And I go, okay, I'm not a woman. What do I have to be to treat you? And if it carries to its logical conclusion, I only can treat you if I'm you. So obviously, we don't allow that to happen. So that's what I talk about. Recognizing they're not re-entering. They're relearning to be a civilian. And it may be difficult, because I haven't talked about what the new stuff I'm brought up obviously in an interdisciplinary way, and the cultural stuff has turned out to be very, very important. Because, any of you heard of the term epigenetics? Anybody heard that one? Okay, been reading this stuff about the social life of genes and culture? Wow. You want to blow your little mind? Take a honeybee and put it in a killer bee hive, and it becomes a killer bee. Take a killer bee, put it in a honeybee tribe, and the genes change. It becomes a honeybee. Whoa! Genes are turning on and off every day in ways that we never imagined. You know, we kind of, you know, I did my original dissertation in genetics. I kind of, you know, I was like, oh, yeah, genetics, we're not going to talk about that. Yeah, it's different than environment. But, you know, we really thought of it as, well, that gene, all those genes for schizophrenia come on, you become schizophrenic. Wow, did we have it wrong. The new epigenetic stuff makes evolution almost irrelevant in terms of what it means for human behavior, because it responds entirely more quickly. And what does it mean? Boy, I'd love to have a discussion. What does it mean when you take a soldier and you encourage, who may be self-selecting in some ways, to be able to be aggressive? Okay? Because I always talk about, I have predictability. You may get PTSD, and you may have a flashback and be scared to death. And then I know you'll do one of three things. You'll freeze, you'll run, or you'll fight. But I have no idea. Oh, you're a vet? Okay, you're taking my head off. You're going to fight. That's your training. How much is that changing genetics? How long? What should we be doing to assume that? Because I don't know of any way to measure it at this point in a living human being, but it sure makes sense. It sure makes sense. Now, when you talk about some of the physical changes, my favorite is the fish that puts on 25% of its body weight overnight when the alpha male is taken out and changes color. And the genes have done that. Literally overnight, genes are turned on and off. Cultural competency, maybe that's my message. Think culturally competency. That requires, to understand culture, you have to understand psychology. And now maybe we're back into another one. We're going to have to understand genetics. We're going to have to think, what can we do to turn off the genes we don't want working anymore? What experiences must we do? So, but that's still my answer, saying, hey, we have a cultural problem.
But in some ways it goes both ways, right? This international student recognizes they're coming from a different culture.
Yes.
Would you say that the veteran recognizes that they're coming from a different culture?
I don't think they are, because again, remember our buzzwords. Language counts. Remember we suggest to them, you're reintegrating. You were a civilian and you went and pretended to be a soldier and now you're a civilian. Well, no, that's not what happened. We took all your civilian training and culture away from you. We enculturated you with entirely different set of values. They work really well in combat. And boy, will they get you in prison and in trouble real quick and get you socially isolated. And by the way, what is the main effect of social isolation on health? Oh yeah. You want to change one thing in your life to get healthy? Stop being socially isolated. That doesn't mean go to parties. Because you can be socially isolated in a group, but the research is very clear. If you feel socially isolated in this room right now, your risk to your health is infinitely higher than the person who's living in their dorm, hasn't talked to anybody in 4 days, but feels socially connected. So that's why this cultural issues is, we're not saying come back to our culture, okay? Yeah, I understand. Wow, it must be hard, but guess what? You're going to have to learn how to like American Idol again or something like it. There must be something. We do have a lot of things in our culture. Maybe that's why they come to school. Because after all, isn't that why we did? To do something important that we thought was important? To be part of something bigger than ourselves called our discipline? So that's what we have to talk about.
Well, I'm thinking how I would deal with a student, as a veteran, student veteran, who doesn't fit in. He's a room full of Ken and Barbies that are talking about American Idol, and what would I say to them if I sensed that? I talk to them, just as you've repeatedly suggested, and you get a sense that they feel alienated because they don't fit in culturally. I'm going to tell them, hell, I don't fit into that culture either because I don't give a damn about American Idol, and I don't like Ken and Barbies. I despise the Mattel company that created that bullshit.
Okay.
Okay, so you're not alone.
Okay, well, remember.
So I would say find people in this classroom, because there's a fair number of them that don't like Ken and Barbies and despise American Idol and consider that trivial bullshit. Let's see if we can find those students, and we'll create a community for you, and now we're reintegrating, aren't we?
That's right.
But culture is not that simple. I can say to the veteran, it's not that simple. You're stereotyping.
Right. Well, remember what we just said. When you make it a cultural issue, that's what he pointed out. If you make it a cultural issue, you can point out all of us share their belief. We're in the top 1% too, or a rare 1%. Right? How many people have PhDs in the country? 1%. How many are in the military? 1%. Oh, kind of suggests that maybe we're as culturally alienated as they are from parts of the American culture. But isn't that a better conversation than I'm scared you're going to have a flashback and kill me because I mentioned war?
No, I'm just reducing how I would deal with it based on what you suggested.
Yeah.
How would I maybe help them culturally reintegrate?
And that, notice what I'm getting at. It's about reframing. If we reframe this as cultural competence, communicating within a culture. And by the way, maybe that's why you chose my class, because it has some meaning to you. Whether it's English, whether it's anthropology, whether it's physics, it somehow must attract you. That's why I'm here.
I feel like I could also call up the completing the mission, but yeah, I'm sure that these students are annoying, but you have to do this group project. And so part of what you're doing back in the civilian world is figuring out how to be around people that you don't really enjoy being around, but we got to complete the mission.
And correct, you talk about completing the mission. And here's my analogy. I use team sports, and that sort of sounds like I'm denigrating war. But that's what completing the mission is. We're going to score the touchdown. I don't have to like you as the wide receiver. Just catch the damn ball. Don't talk to me afterwards. I don't care. But catch the ball. And that is part of the point of what we're telling them. This is a culture where you're now responsible for your own mission definition. For your own, what are you going to do now that's bigger than you? Psychology and neuropsychology is bigger than me. That's why I've always worked in a multidisciplinary team. That's why Bud sucked me into this. He got me talking to sociologists. Ow. So that's the issue. You got to help. You got to look at it from that issue. Then you're having a conversation. You're having a conversation. I don't fit in here either. Okay? We all know that. Come on. That's our conversation on campuses this day. How? My daughter plays for the University of Oregon. I go to that campus and I look at the sports facilities and I go, really? Really? This is an institute of higher learning? Wow. Don't even get me started about their salaries. But we're talking about, do I feel on one level culturally connected, on another level, are you out of your mind? This is a crazy culture. And I had to learn to deal with it. Doesn't mean I bought into it, but I've learned to appreciate it also for what it does good, because I've seen it firsthand with my daughter. Because there's one thing I know about her, she knows how to complete the mission. Because anybody who can get through pre-med while being a Division I athlete is, wow. Okay? That's what you have to tell these people. They do have skills. Culture does translate. Discipline works. Gets you through your dissertation as sure as he got you through the battlefield. But that's the conversation. But you notice now we're fellow strugglers. I don't like this culture either.
Way you establish a rapport with them.
Well, because guess what? They've been taught about other cultures and how not to get shot and how not to offend them. Okay? How about another conversation? Why don't we talk about another ism? Warriorism. We discriminate against warriors. Let's get real. Okay? Nobody wants warriors in our society, but, you know, life is hard. We do need them. I want the best ones. I don't want Egypt's army, thank you very much. I want ours. They're better. So we need maybe accept that. We may not like the policies. We may not believe in the policies. But the vet is merely the instrument. And maybe we do have some warriorism. Both sides. Maybe they have an ism and a schism. And I used that. I went to a conference, and that was one of the talks. How do you handle the legal system, the isms and the schisms, the sexism, the racism, the schisms and the isms? And maybe we need to do that with the military. Both sides. Remember, I'm always on the vets. I'm not talking to vets today. I'm always like, no, don't give me that crap. You can trust some of us. Okay? Don't make it, not sorry. So we're talking about boundaries, about what your experience is, and how that gets in the way, and how that can help. And that's the whole point of this. Right. We're trying to break down the boundaries. And that's why what I put up here blew my mind. Every other thing, the theme, respect, respect, respect from the vets. Faculty, fear, 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 fear. Yet, you're still both in the 1%. Different 1%. In each 1%, there's more subcultures than I can name. But you know, somehow English teachers, professors, still manage to talk to physics professors. It's kind of rare, but once in a while.
Yeah, don't try to figure out where they're at.
No,
Never will.
you don't have to figure it out. Ask. But remember, it's about how you frame the question. Wow, I don't understand you. What was it like to kill, and how many did you do it? Oh, well, there was a good conversation starter. Or, you know, wow, I'm really struggling. I can't imagine going from a war zone back to being a civilian. And I know just a little bit that, boy, the military culture is different. I don't understand. I just know it's not civilian. Tell me what that's like. I wonder which conversation keeps going. And that's my point here. Be culturally competent. Culturally aware. Not culturally equal. George here, he's a Sioux. He's teaching me. What I know about Native Americans, come on. Native American vets, oh wow. From a warrior culture, I don't pretend I know. I say, do I have it right? Tell me about it. What does it do? If you're a Sioux, what do you do? How is that different than what the military told you to do? How is that different than you being in a third culture? Whatever American culture is.
And then
I don't know if you heard that. Remember, his society is the end product of a genocide. And yet he's fighting for the group that, committed genocide. Okay, figure. Talk about how confusing it. But you can talk. You can demand. That's what we're supposed to do as educators. We will talk, but there are rules of engagement. We're not Fox News. We don't talk at the same time. We don't yell and scream at each other. We don't call the other one baby killer and the other one wimp. Or worse. Okay. So you pointed out, not only dealing with PTSD from combat experiences, but think of the concept of transgenerational PTSD. Think of, guess what? Wounded knee. Did we have fun there? Okay? So, but we can talk. That's why this institution exists. To talk. Not to be right. We're all supposed to have a very simple cultural ethic in here. What I know today is true today, and tomorrow probably isn't. And boy, you want to know? Look at me. When I started neuropsychology, hot shit. I was 1 of 10 in the world. I'm not making that up. There's 100. First international neuropsychology meeting I went to, there were 100 people. Now neuropsychology is dead. You know why they're dead? The Beatles came along, got rich, and their engineers invented the CT scan and MRI scanner. You don't need me to tell me whether there's something wrong in your head. I can take a picture of it. Put me out of business. What can I say? So, you got to learn to talk. The good news is there's more disciplines. Every time you think you get bored, epigenetics come along and you go, oh God, now what do I do? How do I dial that into treatment recommendations? How long does it take to change? What kind of cultural, psychological treatment is going to turn off the genes I don't want expressing themselves in this environment and turn on the ones I want? Remember, we figured out how to do it with warriors. Okay? If we don't think we changed some genetics, then I guess you kind of think the world's flat, okay? So that's really my pitch to you, is think of it as a cultural issue, because then you can say, I don't understand your culture, right? There's cultures I don't understand, but I want to learn about. There's cultures I don't want to be part of, that I want to learn about. We're educators. Back to our original mission. Away from the one where we're going. We're not supposed to be here to get people jobs. We're supposed to make people interesting around the table and know something about everything. Okay? That's what we did this for. So that just requires, and I'm suggesting, we have a cultural problem. It's a whole lot different than we have a political problem. Politics is culture too. I'm not saying it's not. But it's easier. It's easier. Tell me about the warrior culture. Tell me how that's helping you in here. Tell me how that's not. I'm confused. You have discipline, but you're not turning in your homework. You crawled off Afghanistan drinking sand, but you can't write a 5-page paper. Okay, I give. What's wrong culturally? What am I doing wrong? Back to the original one, my therapy training. You're not getting well. It's not, why are you a bad patient? It's, what the heck am I doing wrong? That's what an educator is too. If you're not learning, what is it that I don't know? Technique, your culture, your language. It's my job to know that. Have a conversation. What do we have left? Real simple, I'm going to go through this quick. If you're going to talk about war, somebody said, well, warn them. Hey, we're going to have a conversation about war. And oh, by the way, you might have something to say about that. Okay? How do you deal with the graphic presentation? Tell them, remember what they said, we want a strong syllabus, let us know. Just don't surprise me. Because, see, if I had a bad day and the VA canceled my appointment and I'm kind of, having a little problem because the campus police lit me up and I thought they were going to arrest me and they had the wrong guy and now you're going to show me pictures of war, maybe I think I won't come in today. Just let me know. The psychological elements of war. Wow. If you teach anything about war, if you teach novels that use war experiences, literary devices, yeah, you're going to get some feedback. Because from a vet's point of view, novels about war use war as a literary device. They're not about what war is really about when you experience it firsthand. But by the way, they got something to say. Okay, what he said when he talked about war, his problem wasn't with the professors. They did fine. It was the other students who put in their nickel's worth, okay? So remember, we're back to the one. They want you to be strong in the classroom, and if somebody's saying something doesn't make any sense, if somebody's being stupid, your job is to tell them, we don't use those kind of words. You wouldn't allow other isms in. You wouldn't allow a student to make a racial comment. Why would you allow them to make a warrior statement? Okay? That's your job, to keep control of the classroom. So that's the rest of it. It's not all you. It's got other students in there. Some of you said that they refuse to read text. I don't know. Ask them. What do I know? I don't know why people choose to read different texts and not others. Interest, not time, I don't know. It's back to, I'm an educator, I don't see you reading. You know, this is our third quiz. I look at your book, it hasn't been cracked. Can I help you? Fear, okay, that's what we're getting. Okay, so here's your summary. We talked a lot about it. I want to go through this real quick, about 10 minutes. It's a cultural issue. Become culturally competent. Be willing to admit the vet knows more about some things than you do. They were in Afghanistan, they were in war, they were in Iraq. They know, they know, they know. Respect it. Keep the lines of communication open while recognizing you speak different languages. So here's your test for today. What Oscar Wilde code am I talking about? About cultural competence. Anybody know? Oscar Wilde said, England, America, two countries separated by a common language. Oh, warriors and educators, two cultures separated by a common language. Learn the words are different. In England, bonnet is not what you put on your head. It's what you lift up to check your oil. So remember, that's the same thing with the vet. He's learning your language. Last one. You're in the same boat. The vet doesn't want to be afraid, and he wants respect too. And you don't want to be afraid, and you want respect too. And I have one last one I meant to do earlier, and then I'm going to quit. I'm going to read you a quote that I think reflects all of our ambivalence. The Marines I have seen around the world have the cleanest bodies, the filthiest minds, the highest morale, and the lowest morals of any group of animals I have ever seen. Thank God for the U.S. Marine Corps. Been around a while. That's Eleanor Roosevelt.